introduce to you our very own Dr. Andahar, who is a medical doctor at Harvard. He has a medical degree from Harvard University. And on tonight, we also have two other special guests. They are both veterinarians to talk about animal health. One is Dr. Jody Kincaid, and the other one is the Dr. David Simmons, who I think we just heard from. So I am very excited to hear what they have to say, and we've had a great deal of success with our Laminine product on pets. So if you have a pet, you're wanting to hear how this product can affect them, you're on the right call tonight. So Dr. Andahar, are you with us?
Yes, I am. Thank you very much. Well, first of all, I wanted to, as always, tell you that I'm a medical educator. I'm not your doctor, nor am I a vet for your dog. So it's important for you to take this as medical education and not treatment. And as always, these statements have not been evaluated by the FDA, and the product that we talk about is not intended to diagnose, treat, cure, or prevent any disease. All right, the main thing I wanted to talk about today on my part will be to explain a little bit about what Cushing syndrome is. And then one of the vets actually has a dog named Trixie, who he's going to talk about, and how Laminine has helped his particular disease. First of all, Cushing syndrome is when you have too much cholesterol that is released by the adrenal glands. It gives the flight or fight hormone. Basically, normally there's low secretion with stress, but when dogs get too stressed, and that can be good or bad, because sometimes when they get, a trip to the doggy park, they get a little bit excited, or it could all come from a tumor if it's very chronic. Now, if it's chronic, it's a lot of stress and can cause health problems such as diabetes, hypertension, extreme hunger, the thinning of their coat and their skin, and to decrease muscle and bone mass. And then, also, if your dog is getting a lot of infections, they should be checked for cortisol. Cortisol can come from the pituitary gland, which is in the brain, which signals to the adrenal gland, which is over the kidneys, to actually release more cortisol. The usual dog types are terriers, poodles, Dachshunds, and the American Eskimo. Symptoms that you might look for are increased thirst in urination, some increase in their panting. Their skin pigment can actually change from a pink to a gray. They can have hair loss and irritability. A lot of times they are misdiagnosed with having liver disease, because a lot of these dogs will actually have elevated liver enzymes, which are called ALT and ALP. There are a lot of expensive blood tests that can be done to diagnose it, but there is a urine test, which is called the UCC, or the urine cortisol creatinine ratio, and it's something you should talk to your vet about. And then circulating levels of the cortisol are normally low, but with this urine test, you can actually see it much higher. And the great thing is that the usual treatments for this are usually nutraceuticals, because most of the drugs have so many side effects that a product such as Laminine, which decreases cortisol, can do a lot of good. Well, with that, I want to introduce our first veterinarian, and he can tell us about Trixie and how well she's done.
Hello, can you hear me?
Oh, yes, you can. Go ahead.
My name's Jody Kincaid. In the reference to, the stress-related diseases, cortisol excess, and all that sort of stuff, realistically speaking, though, what I love with the Laminine, and I'll get into some cases after I speak a bit here, plain and simple, I do a lot of therapeutic nutrition and homeopathy, and those technologies are asking the body to basically do what it wants to do. But particularly with the older individuals, I don't care, if it's a cortisol excess dog. I've seen dogs that are being treated with drugs for, Cushing disease, this, that, and the other, and we put them on something like the standard process adrenal balancing formula for dogs, and things settle right down. But once I started adding Laminine, my results tripled. For what I was seeing, both in terms of speed of response and the quality of response, because I realized that by using the fibroblast growth factors to stimulate the adult stem cells in the body to wake up and to get back to work, that whatever nutritional program or homeopathic program or acupuncture I was using was working so much more effectively. Dogs that come in that are being tested for Cushing's from other practices and that, often the stress of having chronic arthritis and joint problems in that is pumping their adrenals into a state of hyper function, because the adrenals are trying to keep up with the metabolic pain and all that. And, you know, by adding some laminine to their nutritional program, what I see is literally within a week in a lot of these cases, the owners call in, they say the dogs are more comfortable, they're sleeping better, and, you know, the urination issues, all of the issues they associate with the high cortisol are starting to fade already. You know, it's a little different because I don't do a lot of blood testing for things like that in terms of producing case studies that show this, that, and the other. But I have had incredible results, you know, with people they come back for their weekly checkup and they go, what was that stuff we added to the program? Her whole attitude changed, and, you know, she just is calmer, happier, and just seems to be more at ease with life.
Wow, that's wonderful. I think, a lot of dog owners would be very happy to hear all that, and I want to thank you very much for that information.
Sure.
Because I'm not a vet, I'm an MD, but I know that the effect on cortisol should be helpful, especially with these dogs that are so much smaller, or, you know, their weight is so much lower.
Well, you know, even as an ND, though, because I'm an ND as well, and, you know, I've spoken at the ANMA and that sort of thing, and the physiologic principles are basically the same. You know, some of the metabolic pathways differ between cats, dogs, and humans, but realistically speaking, you know, you have to balance the stimulus with the ability of the body to get nutrients and put them to effect in rebuilding systems, rebuilding enzyme pathways and that sort of stuff, reducing inflammation. And so, you know, I have a lot of my human clients that bring their pets to me as well. They all share the same stuff, and they order laminine for the whole family.
Oh, wonderful, wonderful. I'm just going to switch and see. Dr. Simmons, are you there?
Yes, I am, if you can hear me.
If you could please talk to us about Trixie and what you've done, because you actually have lab tests that you faxed to me that prove that it had a great effect on the cortisol. But please, tell us about Trixie.
Sure. This is presented for basic surgical removal of a small mass, and we do a pre-surgical profile, and we saw that the ALK phos was elevated at 3,000, normal being at the level of between 5 and 131, just to make it simple there in numbers. So we pursued, like you had mentioned, liver disease. We did a bile acid test, and that was normal. And interestingly enough, this dog did not have any of the symptoms of Cushing's disease, which is commonly in the dog of urinating a lot, drinking lots of water, have a pot belly look to it. Sometimes they'll have alopecia. So we were kind of puzzled, and so we were lucky to talk them into doing what they call as a specific test that helps us pin it down specifically, and it's called a low dexamethasone suppression test. And so basically that particular test tells us how much steroid is present in the bloodstream itself, and we determined that this particular cause was coming from the pituitary gland, and that's one of the it either comes from the pituitary gland or the adrenal gland, which is a tumor. The one in the pituitary is usually a benign tumor, so it's kind of slow growing, and we had the numbers there. Had a level of 9 as a resting level, which a level of between 1 and 5 is usually normal. So we were, like Dr. Andor said, that the drugs used to treat this particular is very toxic to the animal, and most people don't opt to do it for that reason. So the lady reached out to me, is there anything else we can try? And luckily I'd been on laminine for about a year. And I said, we can try this. It may extend the life. It may modulate any clinical signs. So we went along and we started on one tablet. This dog was about 18 pounds when it came in the first visit. And so she was luckily she was willing to come back for follow-up lab work. So we kind of followed along here for a couple years, and initially we just followed the ALK phos level, which is a biomarker, like I mentioned, in the bloodstream for this particular disease. And it went from 3,000, pretty much down to the low 1,000 level. Let me see if I can find a piece of lab here that went down to 12, from 3,000 to 1,200, which was almost dropped 50% there, just a little bit over. And then I talked her in if she could do another cortisol level. So in August of this particular year, it came back a level of 3. Wow. And so she was willing to continue to use the product, and the last time we measured it, it was staying at the 3 level. So we feel like we've had a lot of success with this. Excuse me, it was 3.2. So that's pretty much in conclusion. We learned from Dr. Eklund, laminine does lower blood cortisol over time, and this is over a 2-year period of time. So that's kind of that's the case in a nutshell there.
Well, that's wonderful. And how old is Trixie?
Trixie's 9 years old.
And how long has she been on the laminine?
She started March of 2012.
Wow. Okay, so almost 2 years, huh? Okay. Yep. Well, thank you very much for sharing that information, and
you betcha.
Appreciate it. Do you have any other animals on laminine? And
yeah, we've had a couple interesting. I've had 2 cats, one with a seizure disorder, and they didn't want to go on phenobarb, so we put them on half to 1 capsule a day, and that resolved it. And that was diagnosed about 8 months ago and still steady. And then there was 1 cat with what we call as idiopathic tremors. They couldn't go to UC Davis or anything of that nature. We're out here in California to do any kind of a special workup. So I said, this is something we can try. And the tremors hasn't gone completely away, but they've modulated to a point where the cat could function. So those are 2 interesting cases.
By the way, for the audience, most animals who get the Cushing syndrome are dogs, but obviously this can be used for cats for other things. But Cushing syndrome itself is used mainly for dogs. Do you have any other animals, different types of animals on laminine?
We got a couple that are arthritic and benefiting from that. And I'm trying to think of some other cases. Some people are reluctant about trying a holistic approach, so it's kind of a tough sell. I live in a community where there's a lot of dairy people and so forth. So.
Well, thank you very much, Dr. Simmons. I really appreciate that information. Yeah. So do the IBOs who are listening.
At least I think it kind of supports what Dr. Eklund has come forth with, that truly does suppress blood cortisol, and I think that's very beneficial for us as well.
Thank you very much, Dr. Simmons. Dr. Kincaid, are you still there?
Yes, I am.
Could you give us a little bit of an idea of dosage for different size animals that you might use?
Well, what I've done, basically, it depends again on the condition we're going for. I use a lot of combinations of laminine with the standard process products, which are whole food nutritionals, if people are familiar with that company. And so for a small dog, well, like just this evening, we had a little poodle come in, early renal disease. We took a bottle of the canine renal support, and added 8 laminine capsules to a very small bottle, about a 1-ounce bottle of dried powder made from organic vegetable juices and that. And we'll mix that up and basically give that directly at about 1/8 of a teaspoon twice a day. On the other hand, if we have a dog like a German Shepherd that comes in with a strained cruciate ligament and you're trying to, to get connective tissue to heal, I'll start them on 2 or even 3, if they're over 80 pounds, laminine a day, and work them back down, usually to a maintenance dose of about a capsule a day. So you could say that I generally will go for about a half a capsule twice a day per 35 pounds to start off for a couple weeks, and then I go back down to just a half a capsule per 35 pounds a day.
Oh, great. Well, thank you very much for that information. I'm sure everyone will find it happy. I have a mini Australian Shepherd, so he's a little hyper, so I might start giving him a little bit of that. Also, I want to remind you that if your dog has increased thirst and urination, increased panting, overweight in the abdominal area, change in skin pigment, especially if it goes from pink to gray, hair loss, which is alopecia, if he's irritable, restless, then you might start him on laminine, because that is the treatment. It is a nutraceutical which can help these things without you having to go through all the costs of all the tests that are necessary to find out if someone does have, of course, Cushing syndrome. Obviously, talk this over with your veterinarian as always, because he knows your animal a lot better than I do.